Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello, everyone, and welcome to Sensei Podcast. It is my great pleasure to introduce our guest today, who is Dr. Sanz, Jorge Sanz from the University of La Fe in Valencia in Spain, a great CTO operator, a great teacher of CTO and complex interventions, and also researcher with a lot of work on different wires as well as DCBs. Again, Jorge, thank you so much for joining us today. It is a great pleasure.
Thank you very much, Manos. The pleasure is really for me. So thanks for the invitation.
Jorge, we had the opportunity to work together at the Valladolid course, and it was phenomenal. But tell me a little bit how you got interested in becoming, first of all, an interventionalist, and then a complex interventionalist doing CTO and complex PCI.
Well, I did my university training in the north of Spain, in Zaragoza, and then I moved to Valencia, which is more in the south of Spain. And here, really, I was not focused to do interventional cardiology at the beginning. So I started to do clinical research on cardiomyopathies. In fact, I did my PhD on this topic. And afterwards, I realized that I really like interventional cardiology. It was a bit late, maybe. So I decided to move to Milan to do my fellowship. And there I stayed for almost 2 years and a half. My passion for CTOs and complex PCA came from there, thanks to Gabriele Gasparini, who was my mentor and the person who put me all the passion on this field.
Wonderful. So it's fascinating. You started as a heart failure cardiologist, essentially, and then you made a complete switch. Do you find that the things you learned in the heart failure arena are helping you now in the complex PCI arena as well?
Yeah, I think sometimes whenever you have a broader spectrum of the things, it might help to you. So I think what it most helped me was for the research part in the heart field, specifically, I was involved in cardiomyopathies. It was a lot of lab tests and research, very basic research. And I think I also got some patience from that. I learned to be patient and not to hurry up so much. So I think I got positive things from my past as a clinical researcher.
Wonderful. And again, patience is one of those things that we cannot emphasize enough for complex and PCI in general. That can help you be successful, also be persistent as well. And as you mentioned, you trained with Gabriele Gasparini, who is one of the great CTO operators as well. How did that influence you in becoming a complex operator, or did you want to do that even before you worked with him?
No, I didn't really. I didn't go there focus on complex and CTO PCIs. When I went to do my fellowship, I had to start it from the beginning, almost from the diagnostics coronary angiography and simple PCIs. But I was fascinated with all the cases that Gabriele was doing, the work of the CTO, and that passion for the technical feature of the devices, the strategies. And I saw that you could apply so many things from the CTO field to daily practice in common PCI. So I think that was one of the things that motivated me to go into this field.
And then, are you how stressed do you get out? As you know, when you do PCI, complex PCI, things sometimes don't go as planned, and there is some stress involved. How are you able to deal with this? Are there any tips or tricks that you found out that can help you to remain calm and take care of these problems when they arise?
Yeah, I try to keep focus on what you are doing, and I think it's very useful to have a person whom you trust or someone with you. At the beginning, I was doing, for example, the CTO salon, And I think that's the worst thing you can do. So having another person, two brains, and think when things get tough, I think is the best thing to do.
Wonderful. And then you did the complex PCI, and then how did you start the program in Valencia? I know sometimes when you start a program in a new institution it can be a little tricky, a little challenging. How did that happen, and what has been your experience so far building the program and growing it?
Well, when I finished my fellowship and I had the opportunity to come back to Valencia, it was my boss who was in charge of the CTOs, but he felt that he didn't want to go any further. So he gave me the chance to keep on with the program. So we started little by little. I think one of the key things was to involve two nurses in this field. We started. Making together like the toolkit for the CTO PCIs all together, reviewing together the cases before starting, and then during the last years getting young people, the fellows involved is very helpful for me also. So we review the cases together and we get in the CAD lab together, and we are always two. This is the best thing we've changed since the beginning.
Perfect. And that's, I know other programs as well, having a second person who works can be a very useful tool for being successful in these procedures. How do you train the people? Do you discuss with them? Do you give them formal lectures? Do you show them live with the case? What has been your experience, the best way for people to learn in your team how to do these complex procedures?
Well, with together with Ignacio Amat, he was doing the VAL Academy course for many years, and recently he invited me to join. And for me, that has been a big step to teach, but also to learn. I think these small workshops with a reduced number of people and a relaxed atmosphere in which we can discuss with very great operators as you or other guests that come 3 times in a year, it has been a very, very good opportunity for us because you see in daily practice how to improve and how things can be done differently from top operators. So I think this way of teaching and making these small workshops really hands-on is a very, very good way to build the program.
Wonderful. And then when you do these cases, mentioned before, complications can happen. Patients sometimes may not have the best outcome. So how much does it affect you, and how do you bounce back and be able to get back and make the most out of it?
Yeah, complications always have an impact on us. I think we are all human beings and it affects us. So during the complication, you try to keep as calm as possible to solve the situation. And afterwards, we always, I think it's very important to review slowly the case to see where was the problem, what went wrong, and what could have done differently. Sometimes just for our health, mental health, you try to negate what happened. So you may say, oh, it was too complicated and the complications had to happen. But you always must make, I think, a positive criticism of the procedure and see the steps where you can improve. So I think that's the best thing from the complications I get, to review the cases, and you learn something and you never forget it.
Wonderful. Now, in terms of um, teaching other people how to do this, what you do, of course, the Val Academy with Ignacio. How what do you think is the best way for people to learn to do this procedure?
Well, we do another course hands-on for complications also with simulators. So I think the best way to do it is practicing. You can read many papers, see some videos, but at the end you have to practice. So how to coil, how to do a ping pong, to deliver a cover stent, how to remove an entrap device. This is something that we practice with simulators. every year. We do it once a year, and I think it's the best way to refresh. I must admit that your videos, they are also very useful. So we've used them many times. The small, for example, how to deliver a coil, your 1 minute video is totally wonderful.
No thing. And again, there's a lot of opportunities, but as you said, there's nothing like the hands-on. So having people come and deploy a coil, I mean, we do some courses as well, and what we're seeing is people have never put a coil. So of course, if you need it for a perforation, and now you have the stress of the complication, and you've never done it, that can be a very much more stressful situation than if you've at least practiced it a few times before and you know what to expect when you go there. But since you're talking about the education, what motivates you to teach people? How do you, and you do phenomenal work on it, how do you get motivated to convey the knowledge and the practical tips and tricks to getting this done?
Well, this came also from my fellowship period. Humanitas, they organize many hands-on workshops and courses, and I think there I realized how important it is also for the team who is making the course to keep updated and to keep a good level in cases of complications. So that was my I will say the motivation for all this course. And then here in Spain, together with Ignacio, you need to have a partner and a group who believe on these kind of projects to work together, because they consume time and they require also a personal effort, important personal effort to carry them.
Yeah, and again, it's a lot of planning, as you said, it's a lot of planning and a lot of work to get this organized, get the curriculum, get the cases, the live cases, the faculty. It's not it doesn't happen overnight. So clearly, phenomenal work over there. What do you find to be the most difficult thing to teach from either the complexity or the complications? What do you think is more challenging for people to learn?
Well, I think that in our field, as it's very practical, we all want to have an expertise doing things with our hand. But I think that realizing how important it is to have the theoretical background, I think that's the most difficult thing. For CTOs, for example, I think you need to have everything structured in your mind, or at least this is the way I see it. If you have a problem A, you must know which is your B, C, D, E, and E alternative. So I think this way of thinking is the most difficult thing.
Perfect. And you're right. And this also, I mean, part of this is the experience, right? I mean, you have this happen once. So the more times you, I guess, run through the algorithm and through the potential steps and the options, probably the easier it gets to appreciate and use them creatively. So that helps there as well. Now, how about the uh, the research component? And I know that you've done a lot of work. What are the things that you're working on right now?
Well, our biggest project now is regarding DCBs. We are running a trial in Spain evaluating the role of DCB in STEMI patients. So we are 16 centers enrolling patients. We have already enrolled more than 250 patients. So this is our biggest project for the last 3 years. And
how many patients are you planning to enroll total?
1,300. So we'll still have a long way to go.
Now, that's a very ambitious and again, great time, a lot of excitement about DCB use. And what is the name of the trial?
It's the Copernican trial. We are evaluating DCBs for the culprit and non-culprit lesion against drug-eluting stains. Its primary endpoint is target lesion failure at 1 year.
Perfect. Is a specific DCB or any DCB? Which DCBs are used in the study?
It's a strategy trial, so we are not really comparing DCB against drug-eluting stent. We are comparing two strategies. We call it a reduce stent strategy, where the goal is to reduce the number of stents by doing DCB PCI, and you can use any paclitaxel DCB. And the other arm, the control arms, is full DES revascularization with any sirolimus drug-eluting stent.
Perfect. Okay, Omega, great study and congratulations. And this will again, there's more and more push for doing this in CTOs, in bifurcations, in small vessels. I think STEMI has not had as much investigation, so this will clearly be a phenomenal study to come out. How about other products? I know you had some work done looking at the wires getting stuck when you use the very high pressure balloons. How did that come along? And you want to tell us a few things about it?
Yeah, this is a project we finished recently regarding the guide wire friction when you use the OPN, the very high pressure balloon, because we realized that when we were using them, sometimes there was a lot of friction when you were trying to remove them from the wire. Sometimes you could lose even the wire, but sometimes it didn't happen. So we thought maybe there is some relation between the wire and the OPN balloon. So we went to check the technical feature of the wires in terms of diameters of the core, the characteristics of the coating and cover, and the friction that you require to remove the OPN. So we've done this test and we hope to publish soon the results. And we have found that those wires with a more uniform profile, they are better whenever you use an OPM balloon as compared to those which have a more taper core dimensional profile.
Yeah, perfect. And I know many people have had this problem where you use the Xeon Blue or something like that, and then you get the wire stuck, and then you have to remove it and everything again. So now many people are, of course, you are being careful in the wires you choose. Which are the wires you found that are the best for preventing the phenomenon of the balloon getting stuck on the wire?
Those that have the core more uniform, and it was the BMW and the Grand Slam. Those were the one with the lowest friction. And the one with the highest friction was the Xeon Blue.
Perfect. So again, I know that people intuitively, many people are using this advice already, but it's good to actually understand what is the mechanism behind it. And as you said, there's this tapering of the diameter of the wire, which I don't think we appreciate because I guess the coil, unless it's compressed, looks fairly uniform. But I think through the study, and you used, I think, electron. Was it high? How did you measure the size of the wire in this spot?
Yeah, we use a micrometer. It was something like a laser to verify the dimension of the core, and it's able to see 0.001 inches of size. So it's a very, very precise mechanism to measure the diameter of the core.
Wonderful. What else excites you right now in terms of complex intervention or intervention in general?
Yeah, I think apart for the research, which I really like it, I think it's very, very important. I think teaching and making a group of young interventionalists in our center, this is what really is pushing me for the next years. I think creating a group, transmitting the same philosophy, working in the same way, it's something which really motivates me. And I think it's my next target for the next year.
Wonderful. Now, tell us a little bit about yourself. How do you remain in good shape to be able to do these procedures, do all the teaching and the research that you are doing?
Well, I must admit that I was not doing that much sport, but for the last 2 years, I've been swimming. So for me, it's some way of mindfulness. I go to the swimming pool and I always do the same. I do 30 pools. So I'm so tired that I can only focus on counting. So it's a good time of the day. I try to go twice per week, more or less.
Perfect. So clear your mind from everything and
Yeah.
just focus on the moment to moment. This is perfect. How about do you have any favorite books? Any favorite movie?
Yeah, well, my favorite book will say is The Lord of the Rings. Is the book has more impacted me when I first read it many years ago. I was fascinated by the description of everything that they even invented a language for the book. So definitely, it was my favorite book. And regarding the film. I saw what's a few years ago. It's called Parasite. It's a South Korean film, which is really I really like it. The end of the film is completely different from what you could expect. So I recommend you to watch it if you have not done so far.
Wonderful. Wonderful. So it's an adventure. It's an adventure or a mystery, a film, or a combination.
Well, I couldn't define. It's South Korean film, so you never know how is it going to end. So it's about two families that have a very different lifestyle, but at the end they have they find a common path, and the end of the film is completely different from what you could expect.
Wonderful. Well, I guess that's true for the things we do every day. Sometimes the end is completely different from what we expect. So I guess that hopefully for the better, but sometimes not always.
This one
How
is not
many?
always, not for the best in the film.
Absolutely. Now, how many hours do you sleep every day?
Well, I sleep from 6 to 7.
All right, right. And then you're able to function. You think that's enough, and you're able to function as you would like for your
Yeah,
day.
for me, it's the perfect timing. 7 hours, I think it's perfect.
Wonderful. And then, in terms of the things that you've done, what are the things that you are the most proud of?
Well, personally, or both, professional and personal. Yeah, personal, I think sometimes in things don't go as you think in life, and you get problems, people you miss, and think getting recover from this, keep on going is what has done most impacted me. I think is what I'm most proud of. Professionally talking, probably the Copernican trial that we were discussing before. It's the thing that it's not finished, but we are still working. But I think it's the thing that I'm most proud of.
Perfect. And again, that's a pretty big effort. So, congrats again for undertaking the challenge. And again, looks like it's moving in a good way, and that would be a very, very useful for the day-to-day practice that we do. What is your eventual goal? Do you plan to retire one day? You're going to be cathing forever? What are your thoughts? Maybe it's obviously it's too early right now, but it's I guess never too early to think about these things.
Yeah. Well, about retirement, I have not yet thought about it. I hope to think in a while, but I love traveling. I really like to travel, so I think I hope to retire when I'm still in fit and I can enjoy to travel around. So I think that will be my goal.
Wonderful. Now, in terms of the field of CTO and complex PCI, as you said, it's evolving. There are algorithms that are fine-tuned, new equipment comes up. Is there any equipment or new techniques that you're excited about or you're looking forward to?
Yeah, I think all the calcium modification to be able to modify, for example, the proximal cap, implantable proximal cap with shockwave like into the microcatheters. I think this is something that might represent a new change in the management of these patients. So I'm really looking forward to this kind of technological iterations.
Wonderful. And then, in terms of the drug-coated balloons, what you said you're evolving, um, do you see them eventually becoming the dominant mode? So, no, they're using more and more, especially in Europe right now. In the US, for economical reasons, we still don't have as much uptake as we could. But are you envisioning one day they could actually replace a big part of the stents that we're putting currently?
Well, I think there is a hype in the use of DCBs, and I think we need data. So we have data for small vessels, and we have data for in-stent restenosis. But I think for large vessels, we still have to make that data. We don't have that randomized data to support the delivery use of DCB in large vessels. So I think first we have to have this data, and eventually, yes, as a concept, it's leaving nothing behind, vessel healing. it's very, very attractive, but we all know about the past with the observable devices. So I think we have to be prudent. First, build all this data to be sure.
Wonderful. And I think that's exactly right. A lot of more information needs to be done. There are the paclitaxel balloons, there are the sirolimus balloons. There is a balloon DCB alone or a combination DCB and stent. So again, lots of things obviously that will need to be worked out. But as you said, conceptually very appealing, and the preliminary data are very encouraging as well. So Jorge, if you had to give some advice to people who are starting or who are early in their careers and they want to follow your pathway, become complex CTO operators, what are the key things you would advise them to do?
Well, I would definitely recommend them to move from the institution where they did all the training. I think going to another place, learn from different people is a must. And don't feel afraid. Sometimes you do things that you don't really know which impact are going to have on you, but things always return to you and they will have a positive impact. So just be brave and move forward.
That's a great point. So travel, which again, it can take the form of a formal fellowship like you had in Humanitas, or it can also be, traveling and working part-time. There's fellowships now happening in the US, I think in Europe of complex. So there is different options. But you're absolutely right that the communication and working in different environments is very fertile for learning and getting better.
Yeah, absolutely. I will come back without that, or I might apply for some of your fellowships also.
Sounds perfect. No, I completely agree. Again, it's exciting. It's exciting time, and I think even without a fellowship, just working to other labs or working with other people, seeing how people do, there's always something new that you learn and you can take into your practice, and I think makes us all better and makes the field more exciting as well.
Yeah, completely agree.
So Jorge, again, thank you so much. Really appreciate you taking the time with us today. Congratulations on building an amazing practice, a great, again, research component, and good luck on getting the Copernican trial completed. And also congratulations on the educational part, and hopefully many people will take part in your courses and learn and become better interventionists. Thank you so much.
Thank you for the invitation and hope to be back soon. Thank you.
All right. Thank you for listening to the Sensei podcast.